It is my pleasure to introduce to you Congressman Dr. Bera. Thank you so much.
Well, I'm up here as a doctor today, right? And I tend to look at the world through those eyes as a physician. And just thinking about the patients that I've served and had the pleasure of caring for. I noticed that it has me up here for half an hour. I don't know that I'm going to fill half an hour, but what I did think I would do is just kind of frame how I came to this issue of addressing addiction, substance abuse, prescription drug abuse, and then in my role as a member of Congress, how I think we can address this, not just at the community level, but also at the federal level, because it is not just an issue that impacts our community here in the Sacramento region, but certainly is impacting communities and families all across this nation. So I'm going to kind of share my perspective through the stories of patients and families that I've had a chance to interact with throughout my over 20-year career. Let's start with, as a medical student, when I was going through my training back in the late 80s, early 90s, we received very little training in addiction, in substance abuse, and in recovery. In residency, you got a little bit of exposure, but fast forward to 1995 when we first moved up here and I started practicing here in the Sacramento region. Fairly quickly, I started to notice that I would have patients, many patients who very legitimately may have been in an accident, injured themselves, something happened in their lives, and they were prescribed Tylenol with codeine, Vicodin, etc. And you would see patients that legitimately had pain that over time became dependent on some of those medications. Some had an addictive personality, and when they took that first pill of Vicodin, which they never had taken before, became addicted just because of their physiology. Others that through repeated prescriptions, they may have started out on 30 Vicodin, then 60 Vicodin, and the next thing they knew, they were dependent on this medication, because when they tried to taper it off, when they tried to get themselves off of those medications, they would start to go through some withdrawals. Around that same time, there was a push within organized medicine saying, doctors are not treating pain appropriately, you really ought to take pain more seriously, and it became part of our continuing medical education to get better educated on the management of pain. And you saw this rapid increase in prescribing. I also saw the joy in some of my patients when you had those patients that really wanted to get off the medications, but again, they were somewhat dependent on the medications, and you worked with them over time to get them off of those medications. Many of them felt like they got their lives back. They felt this joy, and it's not easy. And unfortunately, far too often, those of us in primary care medicine haven't received the training or don't have access to the tools to help our patients in recovery and dependency. So fast forward a few years later, after I left the private sector and now as medical director of the primary health services division at Sacramento County. We saw a lot of these patients coming in with addictions, patients coming in with dependency, but we also saw this challenge that those patients that we knew that were addicted, when we were trying to find services within the community where we could help them go through recovery, those services, particularly for many of your lower income patients who didn't have good health insurance, were just really non-existent. And you would struggle in a fragmented system of healthcare delivery on how you could actually start caring for these folks. I did, this was back in the 90s, and I had our pharmacist run an analysis, the #1 drug that was being prescribed in the county was Vicodin, right? And that was a real eye-opener. So we started the conversation with our local emergency rooms and others, because talk to any emergency room nurse, talk to any emergency room physician, they see a lot of these patients showing up. Again, these are folks that come from every walk of life in the community, from the destitute to the CEO. You would never guess who's dependent or who's addicted, but they span that entire spectrum. And they would come in oftentimes very desperate, and I know you've seen them in the emergency room, and they legitimately were going through a physical withdrawal, and they were desperate. Again, for those on the lowest income rungs on the ladder, it was very difficult to find the resources to help take them through recovery. Again, I would share, when you can get someone through recovery, there's this, how patients have described it to me is, it's almost like this cloud lifts and this fog lifts, and they feel like they're getting their lives back.